Hello, this is Terri Coutee, founder and director of DiepCFoundation.org. I want to thank the Male Breast Cancer Coalition for allowing me to share an important message. This year alone, close to 2,500 men will be diagnosed with breast cancer. At DiepC Foundation, we want you to know, men, you can have breast reconstruction too. If you have a breast cancer diagnosis and are faced with mastectomy, be sure to ask if a board-certified plastic surgeon who performs breast reconstruction can be part of your healthcare team in your decision to have breast reconstruction or not after a mastectomy. You can read more about my story through breast cancer and breast reconstruction at the blog DiepCJourney.com. And again, thank you to the Male Breast Cancer Coalition to share this important message.
Hi, this is Terri Coutee with DiepC Foundation. I'm very honored today to have as our guest Michael Singer from the Male Breast Cancer Coalition. Welcome, Michael.
Thank you, Terri. I'm honored to be interviewed for the DiepC Foundation.
Absolutely. So, Michael is going to talk to us today. We're actually at the San Antonio Breast Cancer Symposium, and Michael and I are both advocating for breast cancer patients, and I want him to tell you about the advocacy work that he's doing, and then we'll field a couple more questions specifically for male breast cancer after you tell us what you're doing, Michael.
Absolutely. Well, I'm a 7-year male breast cancer survivor. I got diagnosed back in December of 2010 with ductal carcinoma in situ. I was stage 2B. When I got my diagnosis, I was floored because I was 50 years old and never heard of men getting breast cancer. My only awareness of breast cancer was my oldest sister Joanne, who 2 years before my diagnosis died from metastatic breast cancer. So when I received my diagnosis, I was shocked because I thought I only had a year to live. Of course, that's all my sister survived was 1 year. I went for a needle biopsy, I went for a surgical biopsy, and several days later I was having a full mastectomy of my left breast. All the margins were cleared during the surgery. They dissected the sentinel and non-sentinel node. Those were clear. My surgeon, after the surgery, was confident that they got everything out. I did have a PET scan to follow up after the surgery, but I am on a course of tamoxifen. Originally, I was for 5 years, and they upped it to 10 years, and I'm now my 7th year of tamoxifen.
Yeah, they've been doing a lot of studies about that at the symposium, this year. So about the benefits of extending.
It's a tough drug for women because I know many women who are on it, but for men it's very difficult. Also, the side effects are not pleasant. I push through on a daily basis, taking. I haven't missed a dose since I started, but the alternative would suck. Yeah,
no kidding. I know, I feel the same way. I'm on an aromatase inhibitor, so I understand, but we've got to be dedicated to these pharmaceutical products that they have evidence, material that is definitely beneficial to our particular scenario.